1892, Philadelphia. Working-class families struggled to pay for medical care. North Philadelphia's nearest hospitals were several miles away. Something had to be done. All eyes turned to Russell Conwell, who agreed to create a hospital open to all, regardless of race, nationality, or ability to pay. Samaritan Hospital opened on February 1st, 1892. It had 20 beds. The tiny hospital logged 202 inpatients and 1,448 outpatients in its first year.
I think our commitment to the community is something that has always been there. Philadelphia is the largest city in the country without a public hospital. And we are the de facto community hospital for one of the poorest regions in the country.
And they have had to deal with some of the real public health challenges that we have in this city.
While at the same time, we're doing all the high-end neurosurgery, transplants, cardiac surgeries.
The roots of the program that Temple is known for today date back to its early pioneers. Developing new approaches, new technology, new research, and new ways of delivering health care. Groundbreaking surgeries and the inventions of dozens of surgical instruments. The birthplace of physical medicine and rehabilitation. The invention of the bronchoscope. The development of stereotactic surgery, revolutionizing brain surgery. The opening of the first child psychiatry clinic in the nation. Remarkable advances in cardiology, including Philadelphia's first heart transplant.
The hospital celebrates its legacy of 125 years. We celebrate the legacy of those who came before us, those innovators, those inventors, those courageous people. We stand on their shoulders and look forward into the future, and that's how we make progress.
Every week we get announcements talking about the latest research trials, the latest innovation here at Temple University Hospital.
Temple gave me back my life.
My dad had a lung transplant at the Temple Lung Center 13 years ago now, so it's absolutely amazing.
From the day I went there, Temple gave me hope that there was a future.
Temple was the place that gave me a second chance at life.
I can breathe. I can breathe.
Temple is proud of its long history of treating trauma patients, which dates back to a local factory explosion just days after the hospital opened. Today, Temple is the only Level 1 trauma center with an adult burn unit in Philadelphia, leaving them prepared for when tragedy struck.
This morning, there it is, right there in Philadelphia.
I was home, and I knew it was time to start getting dressed. I'm going to get this call.
We handled the largest volume of the victims of the Amtrak rail disaster. Our employees were really the ones who stepped up. Without that kind of commitment and that kind of help, we wouldn't have been able to do it.
Healthcare is a people business, so we really celebrate the people, not the building.
Temple University hospital employees are extremely essential for what they do every single day.
I'm third generation working here at Temple. My father and grandfather both worked here, and they retired both from Temple. Temple feels like family to me.
A lot of folks who've been here 45 years, 55 years.
I came here to Temple University Hospital in 1986, so this is my 31st year.
I've been here for 35 years.
35 years.
I first came to Temple in 1991.
November the 22nd, 1966.
Been here 40 years.
35 years.
50 years.
I've been at Temple Hospital for 35 years, and I'm the lead MRI technologist.
I am Director of Risk Management and Quality Management.
I work in the clinical lab.
I just love the place. I love my job.
125 years ago, Temple University Hospital was founded on the idea that quality health care should be available to everyone, and that mission continues today.
What's our mission? Patient care, community service, teaching, and research. We inherited something great. We take the responsibility seriously, and we hope to leave it a little better than it was before so that it can carry out its mission. It's really part of who we are and always will be.